before I begin, I would invite everybody to close their eyes. We don't really know each other all that well. I'm about to ask a couple personal questions. Either raise your hand or make a mental note, whatever you feel more comfortable with. If you've suffered from depression, suffered from anxiety, anger issues, bipolar, PTSD, have been prescribed medication, or gone to a therapist. Now open your eyes. I'm sure just about everybody either raise their hand or made a mental note.
How do you define depression?
That's not what my thing's about.
What's that?
That's not what my presentation's about.
Oh,
How would
okay,
I
well, you
define
were
it?
asking us if we suffer from depression. I think that's something that needs to be defined, because
Okay.
clinically, you're depressed if you can't get out of bed for 2 weeks. That's the psychological benchmark, just so you know. I'm not trying to interrupt you, but I think for the benefit of the audience, you know, they can't raise their hand and respond to your question if they don't know how depression is defined, because I think most of us have felt sad and have been, like, we've had the blues for 3-4 days or whatever, but not all of us have not been able to get out of bed for 2 weeks. And
Okay.
that's really what clinical depression is, just so you know.
Okay.
All right? Go ahead.
All right, so
You can just write me off as noise.
for me personally, I would describe it as incredibly low self-esteem, inability to sleep, grogginess, tiredness, lack of motivation, et cetera, et cetera. I would point to Marie's entire presentation
Okay.
as well.
Yeah.
So I'm here to talk about the cytokine model of depression, as well as 3 points. I would like to talk about the neurotransmitter imbalance theory, rather, which is the traditional way to look at mental health. The cytokine model of depression, which is the new way to look at it, and the new treatments that go along with this. Okay, so in the US alone, over 16 million people suffer from depression and anxiety disorders, according to the Anxiety and Depression Association of America. As well as 1 in 4 people will have mental health issues, that's the World Health Organization, and in 2013, this is going back 6 years now, over 78 million people were on psychotropic medication, according to IMS Health. Almost all of these numbers have increased because they're all dated by about 3 or 4 years, and most people are saying that, especially for our generation, anxiety and depression and mental health disorders are constantly increasing, and our generation has the highest rates ever. Okay, so the neurotransmitter imbalance theory. This is your traditional way to look at it, as in, if anybody ever seen those memes on Twitter where people are begging their brain for more serotonin, that's what it is. They say that things like serotonin and the other ones are escaping me. Because they're lower, that's what causes your brain to experience depression and anxiety. The chemistry is off, et cetera, et cetera. Now, the traditional way to treat this is with medications, as in, oh my lord,
Paxil. Is one of them.
thank you, Cymbalta, stuff like that. And for anxiety, Xanax traditionally is one of the very popular ones. However, the only issue with that is, speaking from personal experience, my brother is 15 years old, sorry, just turned 16 years old, and he has already been prescribed 3 separate medications, and all of them haven't worked. The issue is, we can measure that certain neurotransmitters are low, but we don't exactly know how to treat them, whether to raise them, whether to lower them further, et cetera, et cetera. The cytokine model of depression completely flips everything on its head. It says that inflammation in the brain actually causes the chemical imbalances in your brain, but it's not the neurotransmitters that are out of whack. It's your hormones that are completely out of whack. Now, inflammation can either be caused by one of 2 things, one being a traumatic brain injury. Traditionally, that would be a concussion or a slight blow to the head from an accident. Some researchers have even reported that being on too many roller coasters and having your head rattle around, that could be it. And the other one is inflammation of the gut, having a poor diet, too many carbohydrates, too many sugars. What happens is, in the case of the gut, the inflammation is in your stomach, and then it seeps into the bloodstream, and then it travels up into your brain, and that's what causes everything. So what actually happens is the chemical processes are completely altered, and then different chemical systems are shut down or disrupted. That could be your balance, your decision-making process, your sleep, etc., etc. Now, the beauty with that is you can actually measure your hormones incredibly accurately. We have doctors for this. They're called endocrinologists. If you have a thyroid issue, you go to an endocrinologist to fix your hormones. A couple of the hormones that are traditionally out of whack would be your growth hormones, testosterone, etc. So most of my information here actually comes from somebody named Dr. Mark Gordon. He is the leading endocrinologist who is in support and actively implementing interventional endocrinology. He is the medical director of Millennium Health Centers and has been active since the late 80s. And he says that when you have somebody come in that is experiencing depression, anxiety, and all the different type of mental health disorders, you can measure their individual hormone levels and their markers for inflammation. And traditionally, the level you're supposed to be in is 10 to 90. But as anybody who's ever taken statistics knows, that is not exactly directed for you. It's a general rule of thumb that was created by a study of other people, not yourselves. So let's say you have growth hormone levels that are at 12. Instead of, technically, that's in the range. It's a little above 10. But yours might have to be 30. So what they do is they take, in that case, a growth hormone, and they give you supplements to raise the level, and they measure you based off that. Another thing that they do is they would give you something called pregnenolone. And pregnenolone is considered to be the mother of all hormones. It is constructed, now I'm not a doctor, so I'm really bad with medical jargon and chemistry and stuff like that, but essentially it comes off of cholesterol and takes one of two pathways, one either being an anti-inflammatory hormone, and the other, I believe it's a growth hormone, I can't exactly remember. But essentially what they do is they measure all these things, they see what you're deficient in, what you have too much of, and then they try and counteract it with hormone replacement therapy. And they have incredible results. I believe I once read that, not yet, sorry. Anti-inflammatory diet. So if you're still a little worried about hormone replacements or different types of medication, you can actually attempt to fix some of these things by yourself by doing an anti-inflammatory diet. Now I did this personally last summer and I felt the effects incredibly. So basically what you have to do is you have to avoid refined carbohydrates. That's your white rice, that's your pasta, that's your bread, chips, all of it. You also have to avoid refined sugars. So that means any added sugar. You can have fruit, but nothing else. Then you're gonna eat anti-inflammatory foods. That's green tea. I usually have about 2 glasses of green tea a day. Blueberries, garlic, olive oil, tomatoes. Usually a very European diet because they're way better off than us. Salmon as well because it's high in omega-3 fatty acids, and omega-3 fatty acids are incredibly good for anti-inflammatories. I have a lot of anti-inflammatories. Now in conclusion, as you can see, I'm not very good at explaining this, and like I said, I'm not a doctor. There's a lot of high-level science and neuroscience that goes into this that I can't even begin to understand, let alone re-explain to an audience. So if anything that I said makes sense, and you're interested, you think this could help you, I'm going to direct you to these 3 places. The Warrior Angels Foundation, which was set up by Mr. Andrew Marr. He was an ex-Green Beret. He was on 17 different medications before he found Dr. Mark Gordon. And within a year, he was off all of his medications, and that includes pain medications. Apparently, their process actually, how do I explain this? It covers the opioid receptors. So, again, I'm not really good at explaining that, I apologize. But, so the Warring Angels Foundation, what they basically do is they take veterans and they direct them to interventional endocrinologists all over the country. And they run a lot of studies because this is still a very new medicine, a very new science. And they said that they took a group of 58 of their patients, and all of those 58 patients attempted suicide a minimum of 2 times, and were typically on between 5 and 15 different medications. And in 1 year, 73% of them were off all their medications, went completely back to their lives, and they said in 6 months, 90% of them had a 50% subjective increase in their own happiness. So that means they took a questionnaire and they saw a 50% increase in their mood. So if you or anybody you know are suffering with these issues and you've tried everything and you feel like you've run out of dead end, look into this, please try it. I've actually recently just directed one of my best friends who has been going to therapy since he was 5 years old and been on medication since he was 10 years old. And his parents are actually thinking about flying him out to California to meet Dr. Mark Gordon in an attempt to save and better his life. Thank you very much.